Thought I was doing myself some good, a daily pill like I was told I should. Then the numbness crept into my feet, couldn't keep my balance on the street. Is it MS? My symptoms are the same. The doctor said you have B6 toxicity and your vitamins are to blame.
In Australia, products containing 10 milligrams or more of vitamin B6 are required to carry a nerve damage warning. This podcast is for awareness only and does not replace medical advice. Please consult your GP or healthcare professional for personalized care. Vitamin B6 is not checked in standard blood tests.
Hello, welcome to B6 Toxicity and Me Diagnosis Stories podcast. Welcome to the podcast that no one wants to be on. And thank you, Ros, for joining us today. How do I know you, Ros? You can tell everyone.
Melissa is part of my story on the journey to solving a lot of issues with my body. She was one of the people I went to for various reasons. When you get to the end, you'll find that she is the person who told me to go and get my B6 tested. So I have a lot to thank her for, her perseverance, and I do think it's making a difference. But my story started in 1996. Now, that's exactly 30 years ago. So when I had a car accident in that year, and I had a herniated disc and a lot of pain in my back, but also discovered that I had breast cancer. So I went through the surgery, then had to have another surgery. And in those days, there really wasn't a lot of help for people with breast cancer. But they did say, we recommend that you take a really good B complex, so that's what I did religiously. And I think by about the year 2000, I started to get lots of pins and needles in my feet, which were driving me crazy. And of course, you automatically think, well, that comes from the back injury. It must be the back. So I saw an orthopedic surgeon. We went through various things with her. Yes, had a few cortisone injections. Yes, there was an incompetent sacroiliac joint on the right side. But the pins and needles persisted. Nothing really changed. So I tried massage. That's probably where I first came into contact with Melissa. And then I tried, it was a different massage therapist at the time. And she said, well, maybe go and see this podiatrist. She's solved a lot of problems. So I went to her. I left her, she was in despair more than I was, that nothing seemed to get rid of the pins and needles. And then somebody else suggested, well, go and see a chiropractor. If it's got anything to do with your back, maybe see a chiropractor. Did all of that. Mind you, spending lots of money along the way, that made no difference at all. Continued seeing the orthopedic specialist. She really tried, but nobody could figure out what was going on. And then I was diagnosed with lymphedema at the time. It was a wrong diagnosis, but I have, unfortunately, the cardiovascular surgeon who actually diagnosed it was short on words and said, you have lymphedema, put these compression stockings on, full stop. Now, I knew what lymphedema was, but the more I thought about it, I don't really think this is lymphedema. It doesn't seem right to me. So I did, with somebody else, we started up a lymphedema group in the area where we live. And that came with finding out a lot more information about lipedema, which is really a metabolic fat dysfunction. So I've got cankles, so down the bottom of my legs, cankles. Well, maybe that's causing the pins and needles, so maybe that's a possibility. Compression stockings, it helped the sensitivity where things were pants were knocking against my legs, but didn't do anything for the pins and needles, really. And all this time I was experiencing the pins and needles, difficulty standing. It was getting really hard to stand for any more than 5 minutes. And also at night, these stabbing pains in my legs. It was like somebody sticking pins and needles in me. So finally, I got an appointment. It was in COVID with a very highly qualified and well thought of neurologist. In fact, 2 of them at a big teaching hospital near me. And they both came to the same conclusion. We think you have small fiber neuropathy. And unfortunately, there really isn't any treatment other than Lyrica. And I I think I tried it for a short period of time, but I don't take well to drugs of any description. So they said, well, there really is nothing more we can do. Now, the big catch is that when I went back and looked at the blood tests that the neurologist took, and I'm just saying she's a very competent neurologist, but clearly the message had not gotten through to any of the doctors about B6 toxicity. My levels of B6 were 874. So and by that stage, I had stopped taking the vitamin B complex, but I was taking magnesium. Neither she nor I knew that all it was labeled was magnesium and a very good brand. Little did she know, or did I realize, that there were 16.4 milligrams of B6 in the magnesium tablets. So in an attempt to help, she said, I think you should double your magnesium tablets, which I did. And of course, that just brought me up to 38 something milligrams. So I really wasn't getting anywhere, I'd have to say. And then I had multiple surgeries, most of them abdominal along the way. Nobody mentioned anything. There's too many extraneous variables. Could it be that I've had irritable bowel for my whole life? Could it be adhesions from the various abdominal surgeries? Could it be? But nothing solved the problem. So then Melissa started talking to me about B6, and I thought, oh, I don't really take any B6 now. And it wasn't until I looked at the magnesium and asked my doctor and said, I'd like to have a test. There is actually B6 in my magnesium, that I was tested, and that's when it was 590. And he went, oh, well, yes, he did at least know about B6 toxicity, though he declined. I gave him a copy of Melissa's book. And he
Just one second. I just want to talk about reference ranges for everyone, because there's two different types of reference range. So the reference range that Ros is talking about is 35 to 110. So when her levels came back at over 500 and over 800, she was way above the ideal range. Keep going.
And the over 800, that would have been up 1,000 or more when I was taking 50 milligrams for all those years, probably 10 years after I had breast cancer. So it would have been sky high then. So I had it tested and said to Melissa, well, you were right. You're absolutely right. My B6 is really high. So I stopped taking any B6 tablets last August. And I do think the neuropathy, I don't get the stabbing pains in my legs anymore, especially there's no sort of somebody sticking pins in my legs at night. And I think, I think that is better. But what fascinates me is that nobody along the way picked up that there was peripheral neuropathy, so the neurologists were looking for neuropathy, but they clearly did not know about B6 toxicity. That was 2020, between 2020 and 2022. So the thing is, one would say, as the UK alerted people in the year 2000, where was our Therapeutic Goods Administration? Where were they on the B6 toxicity? Why didn't they notify people? And even though they've come to the party now and notified, it's not generally well known. I've seen a lipedema specialist. I had eye surgery, talked to the anaesthetist and somebody else at the hospital. I can't remember who it was. And they all went, oh, B6 toxicity? What's that? So the message is not getting through to the medical profession. And I was clutching at straws because I had so many other things going on. And once I saw the neurologist, I thought, oh, well, that's it. Small fiber neuropathy, can't do anything about it. So it was Melissa's persistence. And that's what really annoys me, that it's really the TGA's problem. And then there's an education problem within the whole medical system, from GPs up to, neurologists and specialists. Nobody even knows about it now. when I pick up products in the chemist now that have magnesium in them, you need a magnifying glass to see that anything more than 10 milligrams may cause nerve damage, isn't it,
Yeah,
Melissa?
peripheral
Something like that.
neuropathy. Yeah.
But it's so tiny, nobody would see it. And if nobody knows about it, then, you know, everybody's out there wandering around with all these odd symptoms that nobody can sort of put together all the pieces. I also have a relative who worked in the bariatric unit of a major hospital, and they were doing bariatric surgery. They found that a lot of their patients were getting peripheral neuropathy. Turned out they were recommending a vitamin regime that had a lot of B6 in, and once they realised that was the cause, they stopped having that regime with those patients who had had that surgery. So it's slow to trickle down. It's just so slow. And I think also the supplement industry needs to be held to account for shoving all these vitamins in things and recommending to people that they take this, that, and the other, having no idea of the person's medical history, you know, sensitivities, all those sorts of things. So there's a whole industry out there of supplements, and they really seem to me to have no direction. And I've never had any direction. That it's just add this, add that, add something else. So I think that needs to be tightened up totally. But who would do it? You know,
Well,
teaching has been so slow on all of this. So to me, it's been a problem for 30 years. Whether the damage to the nerve endings can be undone, I don't know. But I do think the pins and needles in my feet and up and legs up to my knees are improved, and I don't get the stabbing pains in my legs at night. And I've spent a fortune to get this far, and I just could have paid Melissa as a researcher, really, because along the way, after that first massage therapist at the same practice, that's how I came upon Melissa. And she's been trying for ages, and she said, "But I don't understand why I can't massage all the legs like I do other lipedema patients." And I said, "Well, it just sets the nerves on edge. It just makes it worse. The B6 alters the treatment for lipedema, that it's not standard treatment." And I did see the sort of the main people who deal with lipedema and lymphedema in Sydney and asked for clarification is what's wrong with my right leg? Both legs have lipedema. All of these things that I'm feeling even worse in that leg. Is that in any way to do with lipedema? And she said, no. I think what you need to do is go to a pain clinic to try and sort that leg out. So that will only take a year to get into, really. And as I'm 76, well, who knows?
well, you know about my diagnosis with the
Yes.
hernias,
Yeah.
but you've also had issues with hernias
Yeah.
too. And hernias are common with people with B6 deficiency, but high
Yeah, that.
B6 causes a functional deficiency
Mm.
in B6 at the nervous system level.
Mm.
So people with B6 toxicity don't build their collagen levels as well.
Mm.
So, yeah,
So it could be.
I'm
There's
researching
so
the
many
link.
things, you know, it's an old body, so too many things along the way. Try and sort that through. Well, we tried to sort it through. Everybody's tried to sort it through, but you, there's just too many extraneous variables. And it was only that Melissa came up with the B6. So I thought, well, I'll give that a go. And she was absolutely right. But there are still other things that are probably causing problems simply because of degeneration and wear and tear, like my shoulders. But the hernias, who knows? You know, I've always had irritable bowel since I was 10, I'd say. And I had an emergency appendectomy in 1959.
It just going to hernias for a second.
Mm.
With different issues with women, sometimes the appendix can be drawn into a thing called a canal of Nuck.
Mm.
And because your hernia specialist is over the cliff now.
Yeah, unfortunately, it's a very lovely man who died way too young, yeah.
Um, and you don't know much about what you had as surgery. You don't know if maybe the appendix could have got trapped outside the abdominal wall or something, and that's what caused the problem.
Well, it was gone. It had been removed, so it
Yeah,
has to
but I
be
mean,
that's yeah,
back in the day,
yeah,
it could have been always an abdominal wall problem.
it could have. I mean, it could have, because I don't know. It was just, 1959, things weren't, and it had to be done in a hurry. I think they were sort of, exploding or rupturing as they took them out. So I guess it could be any of those things. And that's why I tend to think I always blame the irritable bowel on that, really, because I felt there had to be a lot of adhesions left from that. And the hernia, one, I could feel it would pop out and I could pop it back in. I thought, what on earth's that? And I saw the doctor, and when they did the ultrasound, they came up with a ventral, an umbilical, and two small inguinals. And the doctor came very highly recommended, and he was very, very good. But unfortunately, he was returning to work after he had cancer. He was only back part-time, and by the time I went to see him again in 2 weeks' time, he had gone off, and then he subsequently died. And the notes didn't detail exactly what happened. I did have Melissa suggested get another ultrasound to see if they could see any evidence of something not being done, because he was unsure at the time whether he would do both inguinals. And the ultrasound I had really was not perfect. She said, "Well, I can't see any hernias, and I might be able to see a bit of mesh here, but I know, having watched Melissa have her ultrasound, uh, I can see that there's no way mine would have been detected, because they just don't do what's required to detect it. So that is something else that seems to have escaped the medical profession. Or really, I suppose it's the scanning the radiology places, that they should automatically be trained to look for femoral hernias as well, because they're not carrying out the appropriate procedure to detect femoral.
Yeah, and what I find interesting is that most femoral hernias, well, not most, but a fair amount, are diagnosed in an emergency situation, in
Mm,
an emergency setting.
mm,
So to me, that means all our protocols need to change.
mm,
Now, but getting back to B6 toxicity, we've taken a little route, a detour, but I think there is a link between hernias and B6 toxicity,
mm,
because the B6 toxicity causes a functional deficiency,
mm.
and that will stop the collagen forming. But there are so many different variables.
That's the problem. Bodies are
Yeah.
complex. Bodies are complex, and every specialist has his or her bit. So you're left having to try and put the whole picture together. And that's a really difficult part. Well, I've seen this person for that, and I've seen that person for that. Oh, well, that didn't show anything. Okay. But nobody's coordinating. Nobody with medical knowledge is coordinating. And I think that's become more complex as medicine has become so advanced that putting all the pieces together with all the specialty areas is very difficult. We haven't got a conductor conducting the orchestra.
And that's supposed to be the GP, but
But I
what
can't expect a GP to be up on every medical advancement. They're flat out seeing all of their patients. How and when do they get time to learn? So on things as basic as B6 toxicity, that should have gone straight to the College of, GPs or whatever it is from the Therapeutic Goods Administration. I don't understand how they work together, but or maybe they don't, maybe that's the problem. But certainly there should be more education, but concise education. Send out. GPs don't have a lot of time. And I think it needs to be sent out. Look, alert, alert, alert. B6 toxicity symptoms, check what supplements patients are taking. And often when patients go to GPs or even go in for surgery, they're asked to provide a list of their medication, but they leave off the supplements because they think, "Oh, that's a supplement." That's not real medicine, but it really is medicine, and it can do a lot of damage.
Yeah. Um, we I just had a little brain lapse there, but
Mm. I've had a few
yeah.
of those.
Um, yeah. Like, even though we've got our TGA has changed the labeling, it went from 50 milligrams down to 10 milligrams.
But it's so minute. It's just nobody reads that stuff in that tiny little bit down the bottom. And
Yeah.
and things like the one I was taking, the magnesium I was taking should say magnesium with B6 on the front,
Yeah.
but it doesn't. So the labeling needs to change, education needs to change, and I think the TGA needs to get a bit more on top of their game.
Um, like, when I've spoken to my doctor, like, she was the one who diagnosed me. She
Mm.
says medicine is based on a 50-year-old male.
Mm.
So with everything, the education needs to become more holistic. We
Yes.
need
Yeah.
to include women,
Yeah.
but
Open.
with the B6 toxicity, we don't even check that in our blood work. You have to
No.
ask for that
No, that's the
separately.
amazing thing. I mean, I've got other tests, over the years for cholesterol and what have you. So everything comes back perfect. Everything's perfect. So I'd have blood tests. I think I went to a rheumatologist, went to everybody, had bone scans. There was massive inflammation all throughout my body. There are other medical issues that I haven't mentioned along the way. Stent last year and various other surgeries, which just, I suppose, made me think, well, it's just um, too much intervention in my body. That's what's causing the pins and needles. And I was almost willing to believe that it was just totally nerve related from somewhere in my abdomen or spine. Um, so never in a million years have thought that a supplement could have caused the pins and needles. So many years nobody could help, even though many tried for so many years. And I just hope now that the damage isn't permanent. But as I said, I do think some of it's improved, and I will wait for the pain clinic for the right leg. But I'm eternally grateful to Melissa for being so persistent and saying, "This is not right. Don't tell me I'm getting old. Don't tell me I might have MS. Don't tell me this. Something else is happening." And if she hadn't done that, I would not have queried it. And I've told a lot of people about it now, medical and not medical, and nobody knows about it. Not one person. So that's the tragedy of the whole thing, that there are many people out there suffering with peripheral neuropathy and many other annoying symptoms, skin tingling, feeling it's very much a whole body sometimes, irritation to the nerves. People are suffering, and it could be as simple as supplements. It's in the sports drinks that people are throwing down right, left, and centre. Those people will be coming up with B6 toxicity unless that can be stopped somewhere along the line. Those sports drinks, just everybody seems to guzzle those. Um, you've got to try to make people aware, but some doctors are just quite resistant to hearing anything that's out of a layperson's mouth. That's
Yeah.
the bottom line, really.
And I don't think it's that anyone is intentionally not
No,
caring.
no,
It's
I don't.
because it's the lack of awareness and the lack of different protocols, like for checking for B6. Like, the TGA firmly states that in the cases of peripheral neuropathy, that the practitioner should be looking at B6, what
Exactly.
the patient takes in B6,
Yeah. But I
and it
think
doesn't happen.
it's staggering that in 2020 to 2022, the top neurologists did not know about peripheral neuropathy. They took the blood tests, but were not alerted by a score of 870 at that time, and that would have been low compared to when I was taking 50 milligrams a day, probably for 10 years after having breast cancer. Anyhow, Melissa and I sort of just talk to each other.
Yeah.
God help us.
Yeah. Oh, look. And it's what do? We know better, do better.
Done better. You've done
Yeah.
better. But I mean, there have been so many things going on in my body, you kind of just deal with the most urgent at the time, and
Yeah.
well, I'll just have to learn to live with that. That's the way it is. So,
Well, at least we can stop doing one bad thing, which is
yes, exactly.
taking a thing that we thought was helping us.
Yes, taking something that we didn't know we were taking.
Yeah.
In the case of the magnesium.
Yeah.
Yeah. But that warning on the pills now, on the supplements that have B6 in is so inadequate, so absolutely inadequate. You know, people my age need their glasses or a magnifying glass or
Yeah.
both to read it, and it doesn't signal any alarm bells at all. None. None at all.
Yep. No, it doesn't. And
It doesn't give a clue. So it should say, "Get your B6 tested." There should be some clue to what you could do to find out if you were taking too much or how it could affect you, but there's none of that.
no, and in the seniors vitamins, the B6 level goes up as well.
Yeah,
And I have made comment to so many people on supplements that you
don't
need to
take
get
them.
it checked. You
Yeah,
need to check it now. You can't
yeah.
just keep taking these supplements and not check
Mm,
that you're not high.
mm. I've given Melissa's book to the lipedema specialists at Macquarie Uni. I've given it to the orthopedic specialist. I've given so many copies of her book trying to make people aware, trying. It's just a very frustrating thing which causes such a big problem.
Yeah. Well, that's why I wrote it. I was pissed off and
I
I was
got that.
like, I was like, yeah, no one knows about this, and there's no books on
No,
it,
no.
and that's why I wrote it. Not because there's not a lot of information. If you're on the web now, there's heaps of information, but there was no books, and now I've got to do the audio book. So
Well, the other thing I forgot to mention, which I don't even know if I've told you, Melissa, is the orthopedic surgeon said to me, "I think you've got mast cell syndrome."
yeah,
And she did test my blood and she said, "Well, you have. It could cause this, it could cause that, it could cause this, it could cause that." It's almost like a catch-all. You figure out what's causing it. But I mean, she said, freeze meat, get it, straight from a butcher, not from the supermarket. You've got to freeze it. Get rid of anything that's got, histamines in it. And there is an app that can tell you what are the high histamine foods, and you can go through that. For me, it was kind of a catch-all. Yes, it exists. And yes, my blood shows that I do have some of that mast cell syndrome, but isolating what causes it is another matter. And I do take antihistamines now to try and every day she told me to take one in the morning, one at night. Well, I just take either morning or night now. Um, but yeah, so there are all these other things happening which probably could come from chemicals in food. It could come from, there's a one stage in my 20s where I couldn't touch a gum leaf and then touch my eyes or they would swell really badly. So there's bodies are complex, but yeah, so mast cell does seem to go hand in hand with neuropathy as far as
yeah,
I can gather. She was looking to see could there be something else causing all these pins and needles. I did find a book on mast cell. There's a couple of them. I got one on Amazon that was easy to read. I didn't want to go into all the nitty-gritty chemical details. I just wanted a simplification. But it sort of seemed to me like, well, anything can cause it. You'll just have to kind of figure it out. Could be this, could be that, could be this, could be that.
yeah, and well, with B6 toxicity, it affects the nervous system, and the nervous system's right next to the mast cells. So if the nervous
Yeah.
system's pissed off for whatever reason,
It's
it's
going to
gonna
affect the mast cells.
yeah,
And because it's affecting the nervous system, I do get the sensation of the nerves being very irritated, which gives you the impression that you're very stressed. But I'm not really very stressed. But I get more stressed about the feeling that I can't explain. Do you know? It does have that kind of hyper feeling because all your nerves are alive and tingling. And I'd like them to go away and be quiet.
what can we say? I never understood neuropathy until I had it.
Mm.
And not that I'm grateful to have it, but as a massage therapist, I swear the best way I learn is by having it myself.
Mm. Well, that's what people say. If you have a significant pain experience and surgery yourself, you have a new respect for pain and what the patients have to tell you. So, yeah,
I just hope I don't have to do any more learning.
yeah,
Oh,
yeah.
no. I'm done.
All right.
No. Okay. Well, thank you again for being here, Ros.
Okay.
And anyway, well, thank you everyone, and look forward to seeing you in the next episode. And I've got heaps of resources on my YouTube channel about B6 toxicity. If you want to share your story, reach out as well.
Thank you.
Thank you.
As this episode ends, here are a few important reminders. Vitamin B6 is essential, but both vitamin B6 deficiency and vitamin B6 toxicity can share similar symptoms. Blood testing, supplement history, and clinical assessment can help tell the difference. B6 toxicity affects the nervous system, so symptoms can vary widely from person to person. These may include tingling, numbness, balance problems, muscle weakness, electric shock sensations, twitching, blurred vision, bladder urgency, racing heart, gut issues, skin changes, sleep disturbance and mood changes. This is not an exhaustive list. In Australia, the TGA requires products containing 10 mg and above of vitamin B6 to carry a warning about peripheral neuropathy. The TGA has also advised healthcare professionals to review vitamin B6 intake, including supplements and fortified products, when investigating unexplained peripheral neuropathy symptoms. Health Direct Australia also recognises that peripheral neuropathy can be caused by excess vitamin B6. This podcast shares personal experiences and consumer awareness information only. It is not medical advice. If you are concerned about symptoms, supplements, medications, or your health, please speak with your doctor or qualified healthcare professional.
If these conversations or my story have resonated with you, my book, B6 Toxicity and Me, is available worldwide on Amazon. Thank you for joining us today.